Hello, I'm Michelle Fox with DentistryIQ.com. Here today with us is Dayna Johnson, and she is a Seattle-based consultant who is a monthly contributor to Dental Assisting Digest. Now, Dayna, I know that you're here today to talk to us about treatment planning, and when you are consulting, what are some of the biggest problems you see regarding treatment planning?
What I see as one of the biggest problems is that there's no clear understanding of who's responsible for it. It's almost like there's this war between the clinical team and the front office team about who should enter it, who should prioritize it, who should present it, and who should manage it. So I see where the dental hygienist will come up and say, okay, you can schedule Mary for her next appointment, and then the treatment plan's not in there. And then the front office person has to go back and figure out what it is. And it's like, well, I didn't have time to do that because I have to set up my room and get ready for the next patient. And so there's really no clear understanding of who's responsible for it. So that's one of the biggest challenges I see out there in the dental office.
And what are some suggestions that you would give to clients about working more cohesively?
What I suggest is sit down in one of your monthly team meetings and really map out who is responsible for entering the treatment plan, okay? When you're entering a new treatment plan for the patient, my suggestion would be the clinical team is responsible for that. They're sitting down with the patient, they're doing the diagnosing, they should be the ones entering the treatment plan into the computer. So then when the patient is brought up to the front desk, that front desk or treatment plan coordinator has the tools that she needs in order to then give the patient the treatment plan estimate and present the case to the patient, so that when, then there's not this struggle between the front office and the clinical team. Everybody kind of knows what their role is. And of course, I've worked in the dental office for 20 years, and I know the struggles, okay? I know that the hygienist, needs to take a break every once in a while. I know that the assistant is struggling to turn that room over. Now, of course, there'll be exceptions. If you do need to delegate entering that treatment plan to the treatment coordinator, then have a rule for that. Maybe write it on a route slip or something like that. But you need to have some clear guidelines of who's responsible for entering it, who's responsible for presenting it. That way you won't have this struggle between the front and the back.
That makes perfect sense. And before we went on air, we were talking about some of the problems you're seeing in documentation in dental practices. So would you tell the viewers some of those problems and your suggested solutions for that?
Yeah, documentation is huge when it comes to treatment planning, and it is the #1 documentation error amongst dental practices. So it is a huge problem, and so the biggest thing I see is that, the doctors I talk to, the doctors I work with, they say, of course we talk about treatment options with the patient. And I say, well, I don't see it documented in here. He says, well, we talk about it. And I say, well, if it isn't written down, it didn't happen. And so if you're giving the patient treatment options, maybe you're giving them an option for a bridge or an implant or a partial, and the patient decides on one treatment or the other, you still need to have all 3 of those options documented in the patient's chart. No matter which option they choose, make sure it's written down. Because remember,
I would imagine we can't remember everything.
If it's not written down, it did not happen. So,
that makes perfect sense. Can you give the viewers a way that they can contact you about more information that we talked about today?
Yes, they can go to my website, which is www.raydentalmanagement.com.
Dayna, thank you.
Thanks, Michelle.
And thank you for joining us on DentistryIQ.com. We're saying goodbye until next time.